The next one, I believe, is health response and coordination. So we'll go to that. The co-chairs of this are Councilmember Kennard and Jackson Griggs. Brief introduction. Dr. Jackson Griggs is the Chief Executive Officer of the Heart of Texas Community Health Center, what we know as the Family Health Center, which is a 15-site federally qualified health center serving 60,000 patients in Central Texas. Dr. Griggs is a family physician who has practiced medicine for 15 years, focusing on families living in poverty. Before executive leadership, he trained over 150 resident physicians while on faculty of the Waco Family Medicine Residency Program. He's an active researcher and has published over 20 manuscripts on topics of primary care, population health, and mental illness. He is co-chairing that with our own Councilmember John Kennard, who represents Waco City Council District 3. John's service on the council includes involvement on many organizations benefiting diverse areas of our community, but most notably for purposes of today, he serves as the chair of the board of the Waco-McLennan County Public Health District, and this is his fourth term on that board, so he's very articulate and up to speed on all things concerning public health. So I will turn it over to you, John.
Thank you, Dylan. Sorry, my phone was on mute. And my introduction will be brief because I want to turn it over to Jackson, who has served on the front lines of this and can provide the information and update on where we are. As you said, I currently chair our County Health District Board. Jackson serves as vice chair of that board. And so our task force sort of kind of coming together on this is just an extenuation of the work that we've already been doing together to combat this crisis and to gather and garner the health resources available in our community. I appreciate him. He's been a longtime friend, and I know that he, like I said, he is kind of leading the charge along with our other health system providers to combat this and make sure that as we all work to keep the curve as flat as possible and garner as much resources and work together collaboratively as a community to work through this together. His expertise and his knowledge and the work that he's been doing has been vital and has been having leadership and out in front of that. So honestly, I'm going to let Jackson start talking because he's the man with the plan.
Greetings, council members, mayor, and City of Waco, who are in attendance virtually. I'm going to start with just some updates on numbers, and then I'm going to describe clinical information flow, a couple items on public education, and then I think Councilman Kennard will describe some media communications and data. So globally, there have been 1.4 million confirmed novel coronavirus cases with 81,000 deaths to date in the United States. Approximate numbers are about 387,000 confirmed cases with about 12,000 deaths. And in Texas, 8,262 cases and 154 deaths. In McLennan County, 58 cases, 5 currently hospitalized, 4 in critical condition. We've had 20 that have recovered, and we have had, as you know, 1 death. So critical information flow is vital. This is really complex time, both in healthcare and in public health. And so I'm going to describe each of the nodes that are involved in critical communication. So envision, if you will, nodes that are overlapping. There's a lot of the same professionals are involved in multiple of these nodes and are communicating on a regular basis. So the first node is there's a daily huddle with executive healthcare leadership, city leadership, and county leadership. The second node of communication is the COVID-19 leadership response team that's been meeting now for several weeks. The purpose of the leadership response team is information updates, coordination, shared problem solving, and it's chaired by Dr. Brenda Gray, our Director of Public Health District. The members of the COVID-19 Leadership Response Team, medical leadership from both hospitals, Family Health Center, Premier ER, the Waco Mayor and City Manager's Office, the Health District Board Chair, Councilman Kennard, and key staff, as well as McLennan County Judge's Office and Medical Society President, Dr. Bill McCuniff, is on that leadership response team, and there are a few other key emergency personnel. That weekly meeting has been vital. Commonly, we're discussing in that setting coordination of medical and public health services, personal protective equipment, predictions about peaks, contingency plannings for need, and public health education. So that's the second node. The third node is the Emergency Operations Center. This was activated by the mayor's resolution that implemented the Emergency Management Plan. The Emergency Operations Center, or EOC, has a purpose to be the central command and control facility responsible for emergency management. It has a strategic and logistical role and is led by Dr. Farley Werner. Dr. Werner, who's also our health authority, is an infectious disease specialist, somebody who I have worked with for years on cases. I trust him implicitly. He's an outstanding physician and a great thinker. So we're fortunate to have Dr. Werner at the head of our EOC. The incident commander is, so under Dr. Werner is Dr. Gray, and her deputy incident commander is Stephanie Alvey. The EOC director is Elizabeth Thomas. So they're all vital to leading the EOC. And the EOC is meeting daily, has met with hospital and FHC medical leadership as recently as this past Friday. The fourth node of communication is the Heart of Texas Regional Advisory Council, or the HOT-RAC. The Regional Advisory Council is functioning right now as the medical branch for the EOC. The HOT-RAC is an administrative body that's created under state statute. It's responsible for coordinating time-sensitive regional emergencies or disaster needs. So while in periods that aren't public health, infectious disease emergencies, they are coordinating stroke and heart attack and traumas in the McLennan County and in surrounding counties. And the executive director is Christine Reeves. The HOT-RAC right now is responsible for envisioning if there is a need, and right now there's not a high likelihood of this need, but if there is a need for a surge site or an alternative environment for care outside the hospitals, if the surge exceeded the hospital capacity, the HOT-RAC would be the entity that would operate that. And then the fifth node of communication is the Medical Society. McLennan County Medical Society represents 450 physicians who are united to serve McLennan County in matters of medical care, prevention and cure of disease, and improvement in public health. The Medical Society is communicating on a regular basis with physicians who are a part of Ascension Providence, Baylor Scott and White, Hillcrest, as well as Family Health Center, and those physicians who are not part of those three systems. It's also communicating on a regular basis with EOC to coordinate personal protective equipment needs. The president of the Medical Society is Dr. Bill McCuniff, and the board meets monthly and recently has been in contact even more frequently than that. So those are the five nodes of communication. Again, there's lots of overlap, and those have been the Medical Society, and that's of course a long-standing entity. The other leadership response team, the EOC, are more recently been implemented. So when Councilman Kennard and I first met, we recognized that one of the key needs for flattening the curve is public education. The health district has been doing work in public education, and we felt like part of the role of the health response and coordination was to just support some of that education. So we had some preliminary conversations with the strategic communication team, Councilman Sabito and Natalie Kolinsky. And one of the things that we're doing, the Family Health Center is launching a regular video series called Corona 101 to offer some briefs on key coronavirus topics, like what to do when you have symptoms, or how the virus is spread, how to stay healthy while sheltering in place. And those are going to come out Monday and Wednesday, and they'll be in English and in Spanish, little videos that myself, Dr. Ileana Newman, who's a native Spanish speaker, will be offering. And then on Friday, we're going to have a Facebook Live question and answer session with myself and Dr. Newman, just to answer community questions. Right now, those are hosted on the FHC Facebook page, but we'll be migrating links to a more central location. And then, of course, there's lots and lots of educational work that's being done by others as well. I think Councilman Kennard is going to share some about media, other media communications, and then data.
Yes, thank you, Dr. Griggs. I think the key takeaway from what Jackson shared is that people are talking fairly constantly, working together to combat this crisis. Some of the things that we have stood up to help get more information to the public is, as Larry put in his report at the beginning of our session, the COVIDwaco.com. That we hope to be a kind of a one-stop repository for the community to go. Our emergency orders are there, information about current case counts and resources for screening tools are there, as well as what to do if you feel sick. We've tried to provide a singular area for everyone to kind of focus on and go to if they have any questions. It can be that's accessible, that's not overwhelming with information, but that has answers all the pertinent questions and provides anything that somebody might need as should they feel sick or should they move towards this. And Dr. Griggs's education tools certainly fall under that, and we'll hopefully be able to have, if not a link, actually have those posted on that site as well to allow for just one more way to communicate in a variety of ways the specific issues regarding this. One of the things that we have heard from, and I will invite staff to jump in on this if they have more information at this point, regarding data and the need for more data, better data, both from system capacity, testing, things to help us understand, just kind of how our system is holding up through all of this, to see what the prevalence is in the community at whole, and kind of where we are as just as a city and a county when it comes to combating this systematically. We have been working with our local health providers and with the state health department to get that data and hopefully bring a more, we've started providing the reports we provide daily from the public health district, have more demographic information on them. We hope to refine and broaden that in the near future. And there is other resources available that we hope to bring to bear in the near future as well to help give our community as a whole a better understanding of where we are as a county in combating this and how effective the efforts have been to flatten the curve, which the trend lines seem to be positive at this point, as well as where we are going in the next steps in hoping to get, as we work together to kind of get through this. Do you have anything to add on that, Dr. Griggs?
No, I think that was a great synopsis, but be curious to know if council members have questions.
Hi, this is Hector. I do have a couple questions, if that's okay, especially pertaining to data. But first of all, I want to say thank you so much, Councilmember Kennard and Dr. Griggs, for your work on this. on this task force. I know it's very important, and you guys have been so just open-minded and open communication with all of us. And so I really do appreciate all of the work and effort that you're putting in. Dr. Griggs, I have seen the video that you and Dr. Newman are putting out in both English and Spanish. And so let me tell you how much I enjoy those. I try to share those on social media as much as possible just to make sure that the word is getting out. So I really do appreciate those videos that are being questions about data, and I want to ask this, and please know I'm asking because I've been getting questions from either constituents or community members, but, you know, how can we have access to, or how can the community have access to more specific data? For example, one of the big questions that's asked, you know, we get the numbers on how many positive cases are going on in our county, you know, how many have recovered. But what about tests that are being administered in our county? How do we get that information out, or where can people access that information?
So great question, Councilman Savito. So the denominator is, so the numerator being the number of positive cases, the denominator being the total cases. So the governor's executive order was for hospitals to report testing data, if I have that right. So it pertains to hospitals, and I don't know where that repository of data is, if that's being made public. I can say that the number of total tests that I'm aware of, this is kind of my I don't have exact numbers available to me, but I'm going to give approximations of tests that have been done in the ambulatory setting by Ascension Providence, Baylor Scott White Hillcrest, and the Family Health Center are approximately 1,000 tests that have been administered so far. So those are my rough numbers. About 4.5% of those have been positive. So what that tells us is, we're testing a lot of patients right now. We're continuing to see community spread. We have to keep in mind that somewhere between 40 and up to 80% of spread of this virus is asymptomatic between individuals before they have symptoms. So it could be passed from someone who has acquired the virus, who may never develop symptoms, or has been acquired by someone who is in that dormant or latent stage before they demonstrate symptoms. So the shelter-in-place executive order from the mayor and from the judge were just so timely and so very, very valuable that it is critical that we continue to abide by those executive orders as a community in order to keep the numbers of new cases from surging.
Wonderful. Thank you for that, because from my recollection, that's the first time that I've heard of a number on how many total tests have been administered in our county. So I do appreciate you sharing that with us. And then the other only question I have is I guess it's more of an observation and not so much of a question, but I guess ensuring that all of our community has access to these tests in an equitable fashion, making sure that everyone has the same access to these tests, no matter who's displaying symptoms or feeling ill. That everyone in our county knows that they have the ability to contact their physician, contact Family Health Center, and just ask for guidance and direction. And so other than that, I just thank you so much for all of the work. And really on a personal note, to you and your staff and all of our doctors and nurses that are on the front line just combating this. And so really from our hat goes off to you, and thank you for all of the work that you're doing.
Yes, absolutely, Councilman. And I'm grateful that we live in a community where council members and city leadership are so supportive of the healthcare systems and the work that's being done. And we will continue this conversation on an ongoing basis. And as data becomes more available, I think that there will be new opportunities to share that data. So we will continue to work in that vein.
Jackson, it's Dylan, or Dr. Griggs, it's Dylan. One, on that line of questioning too, another question that I've heard is, and there could be difficulty in tracking this, but the number of people who have requested testing or that have exhibited strong symptoms but have been told by their healthcare professionals that for whatever reason, their age or not having a pre-existing condition, that they're unable to receive testing. And I don't know if that's a data source that is available, but I think so much of this, to the extent it's possible, comes down to a transparency issue for people to really understand the scope of where we are as a community. So I would just bring that up and echo what Hector said in terms of working to ensure that to the extent we can get data, that's being communicated. And I have seen other communities communicating, producing a little more data. And I know that's probably not even for Dr. Griggs or Councilmember Kennard. That might be more for our some of our staff or other community partners. But I do think that that is really critical to try to produce that data. Any other questions?
I have one.
Yes.
Thank you again, Dr. Griggs, for all the work that you have done and will continue to do. I was listening to in line with Councilmember Sabito and Councilmember Meek, was listening to the Surgeon General this morning talk about the numbers of positive tests in people of color, and I wanted to know how we, if that we're monitoring that, if it has any correlation to the inability to be tested by people of color, more so than Anglos. And I also want to know if we are studying that, we would be able to continue to track that, because not that I have seen in the state of Texas's numbers, but in some of our neighboring states like Louisiana and Georgia and certainly up east, the numbers are staggering. In a city where you may have a 23% population of African Americans, 70% of those that are tested positive are African American. And so I just wanted to make sure that was something that we were mindful of and documenting, because that's the kind of data that is the only way we're going to be able to turn the disparity in healthcare in communities of color one way or the other. And the sad part is that it may take a pandemic to do it. But if we're actively looking at those numbers, then we can't say anymore, yes, I know it exists, but I don't know what to do about it. And so that's one of the things that I wanted to make sure I said. And also, I do appreciate the increase in the breakdown of the data, because trust me, I know you get the questions because we get the questions about, do we have enough ventilators? Do we have enough ICU beds? Do we have enough these kinds of things? And those are things that I know that we are protective of that information, but I'm quite sure that there's a way to be as transparent as possible to make sure that just to offer a bit of relief to our constituents and to our people, that that we have the ability to care for them. So that's my statement, not question.
Absolutely, and let me respond to a couple of items. One is, I do think that capacity data will be forthcoming in the near future. I think that there's a shared sense among other hospital executives that that's important to the community, and I see that being forthcoming. I've had conversations very recently with hospital presidents, and they have been first. While I seen the articles in paper, I can tell you firsthand that they are working tirelessly to do excellent work in their hospitals, and I have seen the work that they've done to prepare for this in their hospitals, building capacity, gaining access to needed resources, preparing for this surge. So a lot of what's been taking place at the hospitals has been somewhat behind the scenes, but there's been excellent leadership at both Ascension Providence and Baylor Scott and White Hillcrest. With regard to that, all that information that I think the community is looking for, I do think that there will be more information that's forthcoming. So, on the side of equitable access and equitable outcomes, I am so glad that you brought that up, Councilwoman Barfield, and I had a conversation with one of our board members over the weekend about this. Had a conversation today with Liz Lagala about this exact same topic. There are unacceptable realities in America, as you know intimately, about health disparities and outcomes that align along race, and I would. And we have got to work as hard as we can to minimize any disparities in this disease, in the outcomes of this disease. I think that one of the first steps that we need to take is around making sure that the right kind of education is occurring at in the different areas where we have where there's a sense of authority, whether that's I'm thinking right now about how imperative it is that our educational materials are in English and Spanish for those who are in our community that are Spanish speaking. There are also channels of education and information that we need to understand and make sure that we're tapping into so that we can ensure that all of our community is getting the important information about sheltering in place and social distancing, and not just assuming that if there's an article in this kind of media or that kind of media that it's accessing everyone. So I think education will be imperative, and making sure that education is also getting into the hands of those who have kind of the social capital and the community authority to speak to different subgroups in our community.
Fantastic. Anything else? If not, I'll just wrap up by saying that our health systems and our health providers and our first responders have moved heaven and earth these last few weeks to prepare and get ready and deal with this crisis, and that as the numbers that we've seen do continue to trend up, but have not been as bad as feared, that is due to people complying with the social distancing and with the shelter in place. And if not for that, the numbers would be a lot worse, and our system would be even more strained than it already is. So I want to say that if at the end of this, if it doesn't get as bad as we did fear it was, these measures and these steps and the emergency orders and our deliberateness that we are doing now really is vital to making sure that we are, as the vernacular, flatten the curve, but making sure that our health systems don't get overwhelmed. So I appreciate, again, Dr. Griggs and all of our other health providers and our city staff and the public health district and city manager's office that have been working tirelessly to handle this as we all work together for it. Thank you.
Thank you both so much. We appreciate all your work.
Hey, Dylan, before they leave, before Dr. Griggs leaves, I want to share with you all that we are going to have a joint press conference here tomorrow afternoon at 1:30 with McLennan County Judge Scott Felton, myself, and I've asked Dr. Griggs in his capacity as co-chair of the Health Response and Coordination Working Team, and also in his capacity as Vice Chair of the Waco-McLennan County Public Health District, to be here to answer health questions that may arise from the press. Dr. Griggs, I really appreciate you being willing to do that. I think we need to have a consistent face for the public to hear from, and we've got a lot of great doctors, as you mentioned, Dr. Werner, outstanding physician, and Dr. Gray is excellent in her work. I appreciate you being willing in this capacity to step in and be the voice of health for this. I also want to say, John Kennard, thank you for saying that the reason that we are where we are is because of the order and because of the great work that people across our city and across our county are doing to comply with the order. It is making a difference, and if we were to lift it too soon, all of that would be for naught. So we're going to have to be very conscious about how we approach the idea of ending the order. It currently runs through April 21st. We'll be addressing it again next week on April 14th to discuss whether to extend it till April 30th, which would be the date that matches the governor's order. I think we will certainly want to do that, and I think realistically, it probably will not be able to end on April 30th. So I just want people to have realistic expectations about what we're looking at here.